So, madam, what are the most common fears or doubts you have seen in postgraduate students, and how can we as teacher guide them towards clarity and confidence in this all the fearful and doubtful situations?
So in medical field, you require to do lot of procedures, which requires skill. And what I have seen is the greatest fear is learning the skill and then performing.
Yeah. So the performance
Because
pressure.
performance pressure is quite a lot. You may show them, they may learn, but ultimately performing and getting the result, the exactly wanted result, may not be possible. And there the student can get affected.
Yeah.
And somewhere in his mind, he keeps on comparing himself with the other student and teacher.
Yeah.
That with the same skill, with the same experience, because student is on par with him.
Yeah.
Teacher may be experienced, but that person can perform.
Yeah.
Then why I can't perform? So that doubt of performance gives them always whatever that shaky situation.
Yeah. So
their
hesitation
confidence
or confidence is
shaken. Then they start feeling that self decision, that whether I took the right decision to become surgeons. The
Yeah,
branches
okay.
like surgery,
Yeah.
anesthesia.
Yeah.
It happened with myself also. I took anesthesia, but I took little bit more time for giving spinal or for intubation than my colleagues. And then I started feeling that no, this is not my branch. I must leave this branch.
So self-doubt.
So self-doubt,
Yeah.
that no, I will not be able to do this. Or what will happen to me then? And then everyone will laugh at me. And now, especially when I become senior, what will I teach to my students? Because I myself is not good in that skill.
Yeah.
So that is very important, and that according to me is greatest fear. See, theory you can learn, you can write theory, you can answer in exam, but ultimately when you have to show something,
Yeah.
you have to perform somewhere, then there this problem can come, and there can be lot of anxiety about the procedure. So what teacher should do is that teacher should not compare the students.
Yeah.
And teacher should give enough time, enough space to that person. Now actually you have many simulation labs, and
Yeah.
so the things are much better that you can,
and easier. Yeah.
and much easier because you can practice there.
Yeah.
At our time it was not so. We had to do on a person
Patient
only, on a patient.
Yeah.
And you cannot go on just pricking him everywhere with the needle and giving him pain. So, but you don't have to talk in such a negative manner to a person that you are not good. See your colleagues, how they are doing. No, don't talk in such a way. You try to judge him in by his own experience, by his own ability to perform. And give him enough time give patience, with lot of patience.
Yeah.
Don't say that no, he doesn't do, so next person will do, or that person is good, so that person will do this and he won't do. Don't say such things in front of others. Yeah. Because otherwise that
humiliation
person,
or
that
or
humiliation,
embarrassment may affect
it will
the
be
inner
sort of
core.
harassment.
Yeah.
Harassment to that person.
Yeah.
So a teacher should not do such things, should always try to encourage the student to do the things. And many times their expressions are not very impressive. Many students know the things, but their expression is not very impressive. While some people know very little, but express in such a way that it can
Especially
impress.
the rural students,
Rural
we
students,
face this
because
problem of communication,
language,
Yeah.
very different accent of
Accent
language
is
and
there.
all. So, but be with them. Don't try to discourage them.
Yeah.
And don't try to show that you are somewhere inferior to others.
Yeah.
And that will always help them, definitely.
Yeah. Thank you, ma'am. Thank you, ma'am. So, for teacher, patience, supervision, and practice, and communication,
And encourage.
and encourage.
Encourage.
Yeah. Yeah. So
Yeah.
this is very important, madam. Thank you.